Welcome to BizTech's Health and Wellness Show, where we focus on bringing you knowledge on health and wellness to help ensure a more productive and healthy lifestyle for yourself, your families, and your employees. Now, I'm Brian Fernandez. Today, we focus on age-proofing your knees and how we can take better care of our knees in order to have a better quality of life as we age. Now, to bring expert insights, we have a specialist from Sunway Medical Centre, Dr. Chua Hwa Sen, consultant orthopedic surgeon. Dr. Chua, welcome to the show.
Hi, thank you, Ryan. Thank you.
Now, Dr. Chua, before we start, could you kind of give us an overview of your area of specialization, orthopedics?
Okay, so I'm an orthopedic surgeon. An orthopedic surgeon is a surgeon that deals with bones and joints, and I subspecialize into adult hip and knee joints. Okay, so essentially, what I do is I do all the reconstruction of the knee joint as well as hip joint, including the ligament reconstruction for the young patient, as well as those knee and hip replacement for the elderlies. I do revision cases as well. And so I'm also an avid interest into minimal invasive surgery. So we do scopes work, we do robotic arthroplasty work. That's what I do.
Okay, and we're going to touch a little bit more about that later as we go through the show. But can we start, Doctor, by talking about the knee, which is one of the most vulnerable parts of our body. And could you share with us what's typically involved in knee health? And does age really matter? Or is it more of a lifestyle thing?
So knee joint essentially is the biggest joint in our body. And it is a very, very complex joint. Even though you would think that knee joint is just like a hinge joint, but it actually moves more than just a hinge. There are movement of flexion extension. There are also rotation in the knee joint. And within the knee, there are cartilage, there are ligaments, there are a couple of meniscus, there are also muscle and tendon around it. So for a knee, for all of us, the peak of our knee health will be the adulthood when we just achieve adulthood. That will mean that as we are growing, we grow towards the adulthood, and by the time we are 25 years old or so, that's the time when the knee has got the peak of the health. And at that point of time, many of us would think that we are invincible. We do a lot of things, we'll be running, jumping, and everything, without knowing that we potentially actually injuring our knee. Now, the knee joint is also a weight-bearing joint. So age as well as the lifestyle actually contribute towards the knee joint health. As we grow older and older, of course, the knee age together. The longer we use the knee, the more wear and tear that we introduce to the knee. The knee health will follow by the age will deteriorate. And of course, lifestyle as well. If you compare two persons, one person who is probably an ideal body weight as compared to someone who is a little bit overweight because of the lifestyle because of the eating, then the knee in the person which is of the ideal weight will probably be healthy for a longer period of time.
When it comes to knee injuries, it can range, it's quite a wide spectrum. It can be random cracking sounds when bending or crippling pain, but at what point should we consult a medical professional? Now, are there any symptoms or red flags that we should look out for that basically calls us to action?
So I always classify the so-called symptoms of the knee into these four main symptoms. Yeah? Number one is pain. Now, pain essentially is our defense mechanism. When you have a pain in one particular region of your body, and today we're talking about knee, let's say if you have a severe pain in the knee, out of proportion, not helped by just normal painkiller, that is number one symptom that you should aware of, that you should think about going to seek treatment. Pain, number one. Second, it's swelling. sometimes because of certain injury or non-injury, the knee swollen up. It becomes very, very big as compared to the other side. Because of the swelling, comes with tightness and stiffness, as well as sometimes that aching feeling as well. So swelling is the second group of symptom in which I think if you have it in your knee, that you should consult an orthopedic surgeon. Third group of symptom is instability. What do I mean by instability? It's like whatever action or activity that you do, you realize that you don't trust your knees so much. The knee seems to be wobbling.
So you can't bear weight anymore, is that right?
Yeah. So when you bear weight, in certain movement, you feel like the knee just give way or wobble away. That is when I feel that you should also seek treatment. And last but not least, it is when your knee slowly getting more and more deformity. I'm sure you have seen before many old people. Sometimes their knee is bent so much that it becomes like an O shape or an X shape. So this, when the deformity comes in, it also tells us that it is in an advanced stage of the disease of particular knee injury.
Okay, Dr. Chua, I want to zoom in on what you just mentioned, because I think most people who are perhaps not so sporty probably experience their first instances of knee issues as they get older, probably in their 50s or so. What are the key central problems that contribute to this? Because you mentioned it's inevitable, but why only at that sort of age do people really start to experience this?
So it's essentially is age related. It's wear and tear related. So as we grow older and older, number one, the cartilage thickness that has been there since we were young is being worn away slowly. And when you reach 50, 60 years old, that's the time when the cartilage is thin out. And when they are thin, they do not dissipate the load so well. And then that's when you starting to feel the pain and aching. That's number one. Secondly, the tissue around the knee, such as the meniscus and the capsule and everything, can become hardened as we age. So when it's hardened, it's not so flexible anymore. A little bit amount of movement here and there may potentially cause small little micro injury into it, and that contributes towards aging and degeneration. Last but not least, as we age, the muscle power become lesser and lesser because of sarcopenia, because of losing of muscle. Then the muscle help that to hold on to your knee to a more stable situation is no longer there. That's when you feel that your knee is giving you more and more problem.
Now, I want to zoom in a little bit on knee issues related to sports, because I'm sure you're seeing younger and younger patients. So I myself am an endurance cyclist. I've experienced issues with my left knee, and I'm sure many of our audience who are active in the sports have various sort of related problems as well. What are the most common sport-related knee injuries?
Okay, so like I said just now, in the knee is a very complex structure. There are four main group of things that can easily injure during sport injury. Number one, the ligaments. Okay, in the knee, there are four main ligaments, two at the side, the medial collateral ligament and lateral collateral ligament, and two inside that's forming like an X. It's called the cruciate ligaments. So these four ligaments can get injured depending on how is the mechanism of injury. The ligament can be torn, and once it's torn, you get an instability inside your knee. This is number one. Group number two are the tendons. What are tendons? Tendons essentially are the structure that is connecting your muscle to the bone. That's where our knee movement is. So sometimes in certain injury, you may get a tendon tear or a tendinitis. That's where you get a very painful side of the tendon that's attaching to the bone. Thirdly is the meniscus injury. Meniscus is like two pieces of like a cushion kind of thing within the knee that take the load all the time. And these two meniscus can be torn as well. If they are torn, then you will have pain. you sometimes they have locking sensation. What is locking sensation? Locking means sometimes in certain movement or knee, suddenly you realize that your knee just jam up and cannot be turned and cannot be bent at all. That's when we call it locking. That's normally associated with meniscus injury. Last but not least is cartilage tear. Cartilage is the soft bone that's covering our knee surface. Cartilage can be torn as well. When you have a tear cartilage, you get swelling, you get bleeding inside the knee joint, and then subsequently you have chronic pain.
When are the cases where we actually need surgery for these sort of injuries?
Let's zoom in one by one. In terms of ligament injury, just now I said there are 4 ligaments. Collateral ligament from the side, majority of them, if you were to be diagnosed early, go through a proper treatment of non-operative treatment. That means we immobilize the knee properly, go through a physiotherapy. These type of ligament, majority of the time, do not need surgery. Now, it is the anterior cruciate ligament that we have seen many athletes out there that has torn it before, especially those footballers. Those of you who remember the Ronaldo, the bald Ronaldo, the very Ronaldo, he has torn the ACL 3 times in the same knee. That particular time when he fell down in the middle of the field in the final, that's when he tore the 3rd time of the ACL. Now, ACL, unfortunately, is an intra-articular ligament. It doesn't heal whatsoever. When you have an ACL tear, majority of the time, if you want to get back to your active lifestyle, you will need surgery for that. Meniscus as well, if it is a bucket handle, it will come out and start to give you that locking that I told you just now, cannot straighten, cannot bend. That's when you need surgery. But of course, all these very complex. The best thing to do, if you have that 4 symptoms that I told you, look for an orthopedic surgeon. We'll assess, we'll give you the options of whether you can go without the surgery or go with the surgery.
One of the things is, if we go without surgery, physiotherapy is sometimes a very good option. So I'll share with you my previous experience. So I had an injury when I was cycling in France, and I came back, but because I had been, it was a long event, it was a 90-hour event. The injury happened in the 10th or 12th hour, and I kept cycling, and my knee kind of expanded. Let's put it that way. So you can just imagine what happened with the stress on it for that time. When I came back to Malaysia, I got it attended to, and fortunately, I didn't need surgery. So I didn't damage it enough that I need surgery, but I needed a long physiotherapy. Now, they put me through an exercise conditioning program, which basically they said it is to help strengthen the muscles for flexibility, and also it was very targeted at certain muscles. Dr. Chua, could you kind of enlighten us on why they did those sort of things and how we could look after ourselves better post injury?
So essentially, after the injury in the knee, majority of the time, just like you said, it's expanded, it's swelled up like a ball. So the first thing that the physiotherapy do is to try to manage the swelling. So it's what we call swelling management. So they try their very best by using some of the equipment that is to ultrasound interferential to try to reduce the swelling. That's number 1.
Yep.
Once the swelling come down, when the pain is lesser, with the help of the painkiller, you realize that will be probably take a couple of weeks time. By the time 2 weeks later, you realize that all your knee will be shrunk down, your muscle is lost, your muscle wasting. And the second phase of the physiotherapy normally is to gain back flexibility, like you said, to gain back the range of the knee joint. So they'll try their very best to get you to fully straighten the knee, as well as fully flex the knee or bend the knee. Okay, so this is the second phase. And after gaining the range of motion, last is for the muscle, is to build back the muscle, like you say, target certain muscle group here and there. The reason why we target the muscle group, certain group here and there, is to so that it can also help to align the knee back to the position where we want it to be. Certain group of muscle can pull the patella slightly more central, and so that the movement is better, it's lesser pain. So the muscle power, eventually when they come back, it will help to hold the knee more stable, and by then you will probably gain back your full function of the knee.
Now, Dr. Chua, I want to now ask you more about the impact on the elderly. So especially in your 50s and 60s, when all these problems really start to manifest itself, for some people, there's no choice but hip replacement or knee replacement. Could you walk us through some of those options, and what are the risks involved with the surgery?
Okay, so essentially we stage all the diseases. Okay, so when we talk about a replacement, it is essentially because of the knee or hip, it's at the point of no return. It's beyond help anymore. The joint is so damaged that we have no choice but to replace the joint. So now a joint replacement, let's focus just purely on knee joint replacement. It's a procedure in which we take away the damaged surface of the joint and replace it with the artificial one. And at the same time, we also realign it back. So stage 4 disease, very, very painful in aging people, and that is already deforming their knee joint. That's when we think about potentially replace the knee joint. Now, every single surgery, there's risk. And we always weigh between the risks and the benefit before we embark onto any treatment. Okay, so in an elderly, first of all, we always check them through and make sure that their body or the physiological age is young enough to withstand this kind of surgery. That's number one. Once we make sure that they are okay to go through all this surgery, then only we will embark onto this surgery. Now, any one time we cut open a skin, the number one enemy of all of us is infection. Now, infection happens, worldwide number is 1 to 3% in the primary total knee replacement. And we take good care as well, in terms of wound care, in terms if you are diabetic, we make sure that your diabetic is well controlled and all, just to prevent this infection, this number one risk that we fear the most. Second risk that we fear is blood clots within the legs because of immobility during the pain or during the recovery process. Blood clots. Last but not least, sometimes there are associated nerve or vessels injury, which are most likely preventable. Okay, so these are in terms of the replacement. But to me, I feel if you are not yet into the advanced treatment or advanced disease, we should not even think about the replacement just yet. There are many, many other things that we can do before that to when you first started to have this kind of so-called osteoarthritis of the knee.
Could you highlight some of those options? Because obviously the full surgery option of replacement is the last thing that people want, especially the older persons, because there are also challenges with dealing with that, isn't it?
Sure. So there are essentially many other options. Okay. Options number one, obviously, is activity modification. Let's say, for example, you are 55 years old, you're starting to feel a little bit of your knee pain and everything. And some people say, I do not want to go through any more proper treatment just yet. So what you can do is to modify your activity a little bit, such as number one, weight loss. That is also considered as activity modification.
Because it's less weight bearing on your knees, isn't it? That was the whole idea.
Right. That's right. So if you were to cut the weight a little bit, lesser load onto the knee, you do feel a little bit better. That's number one. Secondly, certain activity you may want to think about avoiding it, such as squatting and kneeling. Squatting and kneeling are really very, very bad for the knee joint. I know nowadays many of us who likes to look good, you like to do some deep squats and everything just to build your quadricep muscle as well as your gluteus muscle so that you look good. But those are good for your muscles and not so good for your knee joint. Okay, so try to avoid all those things a little bit, if you can.
Dr. Chua, running as well, isn't it? Because that's
Yes.
a high impact and that really basically impacts your knees, knee health.
That's right. That's right. So running, it's what we call an open chain exercise. That means you have a period of time in which you are completely airborne before you hit down your foot. And that's when the impact comes. So running, if you want to run, make sure you get a very, very good shoe. Make sure you run with a very good form. Make sure that if you can, uphill is not too bad, flat is okay, but downhill running is the one that is killing the knee joint.
Okay.
Talking about what else can we do to help in terms of food as well. In fact, some of the food does promote joint health. Things like
is glucosamine really, which is the thing that everyone talks about all the time. The first thing is that you have a joint problem, they say, oh, please go and take glucosamine. Does that really work?
Okay, now glucosamine, essentially, it works only in one particular form of glucosamine. If we were to look into all the literature, there's only one form of glucosamine that really help knee joint if you take 1.5 grams per day. Okay, that is crystalline glucosamine sulfate, not anything else. Now in the market, there are probably, I don't know, 1,000 types of glucosamine.
Yes.
Majority of them, unfortunately, the last thing I want to do is to spoil people's market. Is more of marketing.
I see. So what other, besides that, so what do we need to take in terms of natural food perhaps, or any other additional supplements?
So natural food, things like turmeric is actually good for joint. Things like soy-based food, such as soya bean, the milk and salt milk, citrusy food, the lemons, the oranges, these are all good for joints. Okay, so these are the things that are good for joint in terms of natural food.
Dr. Chua, how about exercises? Because food is always one part of the equation. We also then need to strengthen and increase flexibility. What do we need to do?
So for knee, it's very simple. Try your very best to target two big group of muscle. Number one is the quadricep in front. Number two is the hamstring behind. If you can target these two group of muscle, get it strengthened, your knee will feel much better.
Now, how do we then avoid injury? What is the, for example, so we're doing exercise and things like that. The biggest danger, obviously, especially as you mentioned, if you're doing squats, is getting injured doing something like that. What precautions should we take in order to prevent knee injury?
So personally, I feel just number one, any exercises that we want to do, the form of the exercise is the important one. You must make sure that you do it correctly. If you don't do it correctly, that's where the injury can happen. Now, in order for us to do the certain exercise in the correct form, sometimes it's good that we do have a friend to look at us when we do certain exercises. Okay, that's number one. Secondly, always listen to your body. Like I said earlier of our conversation, the pain is a defense mechanism. If you were to do certain exercise, at certain point of time or certain movement that you do, you have this pain. Just try your very best to avoid that particular movement. Okay. These are the two things that I feel that is important. Last but not least, do make sure that you already have the enough muscle power before you embark on it.
Now, what are the easy tips perhaps, and this is really across the board and across ages, that we can ensure that we're taking good care of our knee health? Starting maybe from the 20s, what should we do to set the stage for good knee health? And then perhaps you can walk us through the years.
Okay, so let's think about us at the peak of our time where, say just now 25 years old, we thought that we are invincible. Number one, we are not invincible. Try to tell yourself you are not invisible. You do have to be careful with whatever that you do. That's number one. Exercises that you want to do and everything, I think it is okay that we want to push ourselves, but always listen to your body. That's number two. Number three, good form of exercises are important. Number four, weight control Very, very important. Make sure that you don't overeat, control your weight properly. Next, build your muscle properly first, build the flexibility, make sure that you are flexible, good muscle. Food, just now we talk about food, what are the food that we can eat and everything. Things that you should avoid, deep squatting, kneelings are bad for knee joint. If you were to be able to do certain exercises or anything, make sure that you get a good pair of shoes. Nowadays, many of us do some jumping exercises or anything at home as well. So make sure that you do have a nice soft surface to jump on, not the hard surface. Next is, if you were to have certain injury, seek help early. Now, many of us, small little injury, we thought, let's pop a couple of Panadol and let's see whether is it okay or not. I think it's okay to have that kind of strategy for 2 to 3 days. If 3 days later, the pain is still there, please go and seek help. Get it diagnosed properly, because early treatment is always much better than a late treatment.
So, Doc, if I go and see an orthopedic surgeon, what should I be asking the orthopedic surgeon, and what should I expect in terms of responses?
So if you were to go and see an orthopedic surgeon, first of all, obviously you need to tell the orthopedic surgeon, or the orthopedic surgeon should be able to listen to your history. History means that the mechanism of you getting injured. What is troubling you now? Is it pain? Is it instability? Is it swelling, or is it anything else? That's number one. Secondly, majority of us would have then put you on a couch, examine your knee, check it, and have certain kind of provisional diagnosis of what we are dealing with. Next, we'll probably send you for some scans, knee joints, X-rays, CT scans, and MRI scan. We'll send you for some scans. And by the time the scan come back, we would be able to tell you one diagnosis. That means what is wrong with your knee. That is something that you would want to know from the orthopedic surgeon that treats you. What is wrong with my knee? And then subsequently from there, we can always discuss about the options there is, whether is it non-operative one or the operative one. What's the benefit and the risk? Which one is better? And we try non-operative first. And we try physiotherapy first. So these are all the options that we can discuss. Last but not least, every options you can also discuss with us regarding the potential outcome of what you are dealing with, and what you would expect to get at the end of the treatment. So the expectation we need to manage the expectation in the correct fashion. Let's say, for example, a knee injury in Ronaldo, he needs to get back to international world-class performance. That is a different expectation. One expectation, if you come to, let's say, a patient of mine earlier on, he said, no, I just want to be able to walk properly. I can walk my dog. I can, make sure that I can walk with my kids and everything. That is a different kind of expectation. With that kind of expectation, we probably will not be needing to go so active into treating it as compared to the Ronaldo.
And also recovery then, Doc, basically varies by age, by also physical fitness, and also the level of muscle activation that's between different people, correct? That's right.
So in terms of recovery, obviously, like you said just now, when you're younger, you recover better, you have the power of regeneration, and you have more muscle power, you can recover better. But in any knee injury per se, we are talking about a minor injury. We are talking about easily about 6 weeks of recovery period. A slightly more severe one, 3 months to 6 months. The really, really severe one, up to 1 year. Just to
wow, 1 year. Yeah. Now, Dr. Chua, it's been a fascinating conversation. Any final words to leave us with?
Okay, final words is, I think all of us, like I said, when you do get injury, seek the help early. Get it properly diagnosed. before you think that, oh, it's nothing, I can just leave it alone. That's what I think. And healthy joint, healthy life.
Now, Dr. Chua, thank you very much for taking your time to be on the show.
You're welcome. You're welcome. Anytime.
I'm Brian Fernandez, and we've been speaking to Dr. Chua Hwa Sen, Consultant Orthopedic Surgeon at Sunway Medical Centre on BizTech's Health and Wellness Show. This video will be on our Facebook and LinkedIn sites, as well as our website, www.biztech.asia. Please subscribe or like our various platforms. Thank you very much for tuning in.